Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this Autism Hangout feature program series, Ask Dr. Tony, where everybody's favorite doctor of autism and Aspergers, Dr. Tony Atwood, answers your questions about this condition. Welcome, Dr. T. It's good to see you again.
Oh, thanks, Ray. You always give me those wonderful introductions. I think, wow, it's lovely. It's lovely.
Well, you're well deserving, and I'm always delighted to have a conversation with you. Okay, we have about 10 questions submitted to us from people at Autism Hangout and people at YouTube. Let's just go ahead and dig in.
Okay.
The first question is, I had first heard about NAET, which is an acronym for a holistic allergy elimination technique. I'd first heard about NAET through a friend who had her autistic daughter treated with it. I was amazed at the change in the demeanor of the girl after the therapy had been administered. Just by identifying and eliminating several allergens from her daily exposure, she was able to function far beyond what I had ever seen. Does anybody have any more information on NAET?
Okay, first of all, I don't personally know NAET, but I think this is an important question for something else too. In a way, we look that if somebody's got an autism spectrum disorder, are they prone to anything else? Well, yes, anxiety disorders, sometimes feeling very sad, sometimes having anger management problems. But the latest research is seeming to suggest problems with the immune system. And what we're identifying here is that autoimmune disorders seem to be more associated with ASD than we first thought. There seem to be all sorts of medical issues that need to be explored in autism that have previously been assumed as, well, no, that's nothing significant. Big studies are starting to show that it is. Now, whether allergies are a factor, I don't know, but certainly if you've got someone who's got an allergic reaction, then something needs to be done about it. It probably wouldn't cure the autism, but it makes for a very happier person, a lot healthier person, and then they're much easier to get on with and cope with.
Mm-hmm. So even though we don't know anything specific about NAET, the fact that allergens cause problems is enough to warrant trying to find what you might be allergic to and to find some way to push that aside, assuage that. Is that correct?
Yes, indeed. But it's really going to a reputable person rather than somebody who's a bit of an entrepreneur and is more concerned with convincing you of the product. So I would go to conventional medical services rather than some of the entrepreneurs.
Okay, understood. Question number 2, I am in therapy with a psychologist for anxiety disorders. Some weeks ago, my therapist told me that I may have some autistic traits. Now I have questions. How do people with Asperger's react and cope with life difficulties like chronic diseases or events like the death of a significant person? Can these challenges, especially when they add up, increase social problems? This is from Aaliyah.
Well, the answer very quickly is yes, they do. But I'm going to go through a number of things on that question. When we look at chronic diseases, one of the factors in ASD is going to be pain sensitivity. And often those with ASD may not report pain in the way that other people would do. Now, of course, this is an indication there's something going wrong. So whenever someone with ASD says they got pain, I take it very seriously. There's something probably going on there. But under stress, and it can be emotional stress, it can be physical distress, the features of ASD usually increase. More social withdrawal, greater sensitivity to certain events, more rigid thinking, etc. So when the person is stressed, for whatever reason, we get an increase in ASD characteristics. Now, often the person has difficulty reporting what's the matter, how do I refer to my internal signals. So often a relative who knows that person well may give the doctor a lot more information than the person with ASD can do. It's not necessarily a linguistic problem, but in how are you feeling now, I don't know. That self-reflection can be a problem. Now, the other topic was in relation to the death of a significant person. And here the reaction can be unconventional, that lead others to feel that the person doesn't care, but it's a different way of coping with it. When death occurs, first of all, I have to explain to the person with ASD that other people will become extremely emotional. They may burst into tears. They may look extremely distressed. And the person with ASD needs to know What do I do? Do I leave them alone? Do I make them a cup of tea? So I say to those who may be showing signs of despair in that grieving, please tell the person with ASD, I'm okay. What I'd like you to do is give me a hug. Then I'll feel better. Mm. Now, their own way of grieving is going to be different and again can involve an increase in the ASD features. We would expect a greater withdrawal. The person's not good at disclosing their inner feelings and thoughts to other people, so they're not going to use affection, disclosure, conversation as their way of coping, which means the grieving process is going to take longer. And the person is also going to have their times of quite considerable distress, but they may cope with it by solitude. And relatives and partners may say, but he's gone away for the weekend, literally, and no contact. And so the person is readjusting, recalibrating their life, but they're doing it by going offline, which can be very worrying for other people. And sometimes there may not be the amount of tears that you would expect, but there may be a greater interest in the special interest as a thought blocker to stop those grieving thoughts come through. So when you know ASD, it's very logical and appropriate, but others misinterpret what's happening.
Very good. The next question is from K-Man, and he says, hi there, I just returned from a trip to the U.S. where I was visiting high schools who were willing to support my 15-year-old Asperger's son. He is currently mainstreamed in Singapore, but he's not enjoying his learning journey. The process in the U.S. was made easier as I had an educational consultant help me to find such autism-friendly schools. Is there such a service in Australia? Otherwise, how else can I locate autism-friendly schools?
Oh, what a good question. It's not restricted to Australia. I'm delighted that in the United States, and it may be that particular state, and may be unique to that state or rare in other states, to have someone who will help you find a school. In Australia, we've developed for early intervention someone who will guide the parents in the maze of early intervention strategies as a central person. But I don't know the equivalent of that in Australia or in other countries. What you tend to get is the unofficial good school guide organized by parents. And so it's really going on the internet if you can, or finding the local parent support group and say, has anybody sent their child with ASD or Asperger's to this school? What do they think? And you may have those who are graduates from that school or currently at that school. You need a consumer's view. It's a bit like buying a car. You want to talk to somebody who's driven that car. What do you think of that BMW? What do you think of that Ford? And that will give you an idea, because schools have their protocol of what they're supposed to say. You want to know the reality of it, and sometimes that is what you get from parents.
That makes good sense. The next question is regarding Aspie NT marriages. Do the behaviors and mindsets of adults with Asperger's increase as they age? Does Asperger's get more exaggerated or more involved with age? And then she gives examples. She said, this is what I'm finding. As my husband gets older, he's withdrawing more and becoming more and more indifferent to the hurts that he inflicts on our marriage and to our children. And in his words, he says, he could care less who he hurts. This is from Pegshire on YouTube.
Very good question there. In a way, when we look at ASD, there is a fluctuation in the signs throughout life. Sometimes the features are very powerful in the preschool years, hyperactive, very intense. During the primary or elementary school years, there can be a degree of stability and progress in a variety of ways. Of course, puberty throws everything up in the air, and you have huge changes. But what we get with Asperger's in the mid-20s onwards is a greater degree of maturity and cognitive ability not to get so upset by situations, to learn to read social cues, understand what's required by observation, guidance, and support. So some of the characteristics can diminish over time, over decades. But what I think this lady is talking about may well be somebody in their last decade or two of life. And I find what tends to occur is that the person with Asperger's has used their frontal lobes, their thinking part, to cognitively work out what to do. What's my role? What's my script? And they know by observing and that process of focused attention what to do. But to a certain extent in the last sort of decade of life, you don't care. Sort of, I don't care. That's who I am. I make a mess, so what? So it's a normal human characteristic to be less careful about what you say and what you do. So the person is not becoming malicious. They're more becoming less concerned about how my behavior affects other people. So in fact, the answer is yes, those features can increase as the person ages, and they become more true to their earlier childhood levels. Shakespeare was very good in describing the 7 ages of man. And this is what you get, is the person will then go back, as much as you go back eventually to an infantile level, losing continence, etc. The person can increase their ASD characteristics as they go back through their lifespan.
Mm-hmm. Wow, that's really interesting. Question number 5 is, what is a common reaction of an NT partner to an AS partner when they are diagnosed or when they find out that they do have the condition?
Okay, my understanding is this is how does the neurotypical partner react to knowing that, well, their husband or wife has Asperger's?
Right.
Well, first of all, there are a number of reactions. One is, I always thought he would change. I always thought I would find the key, that he was doing it deliberately, that he won't. Now it's a recognition that maybe he can't. Maybe it's a genuine difficulty. And I always thought the solution was going to be simple. He would just choose to do it, but he hadn't done it. Mm. It sort of takes the wind out of your sails too, because you can get that anger and you suddenly realize in a compassionate way, well, you don't know, rather than you won't do it. Mm. There can also be a sense of relief to know that it's not your fault in a way and that there is an explanation. Now, the next reaction can be one of, okay, we know it's Asperger's. First of all, does the Aspie partner agree? Okay, neurotypical says, yes, you're Aspie. And the Aspie partner says, no, I'm not. And that can lead to major difficulties, because if you say you know you're not going to take on board the strategies. And so for some, it's for the Aspie partner to recognize, yes, this is me, and both working together to understand the cultural differences. It's a marriage of 2 different cultures, 2 different priorities, 2 different perceptions, and working together constructively. But the issue is going to be, how do we do that? And you need external support. Now, there are a variety of ways. One is in terms of literature. And there are some very good books published by Jessica Kingsley Publishers, jkp.com, that are actually written for couples to work through if they can't find a relationship counsellor who knows what to do. Secondly, it is actually finding, if possible, a relationship counsellor who knows Asperger's. Otherwise, the relationship counselling probably isn't going to work because it's based on neurotypical couples, and this couple is different. The third component we look for is in terms of partner support groups for the neurotypical. We have one in Brisbane. It's a wonderful organisation. And in all the capital cities of Australia, we have the group. This one in Brisbane, we meet on the first Saturday of the month, and it's predominantly women, but not exclusively. And it's an opportunity to express your experiences with a group of people who genuinely understand. And what we find is we pass around the tissue box, not necessarily for tears of despair, but tears of laughter, because and my husband, yes, I know he does, and how did you know that? And there's a wonderful sense of relief that you're not alone.
That's right.
And those support groups, well, we have people in the support groups who are very deeply in love with a person with Asperger's in the very early stages of the relationship, right through to those who are grandparents. And they can then support each other as those who have been through those characteristics and from their experience can give advice. Now, that's advice from personal experience, advice from relationship counsellors, and advice from literature. So that's what I would suggest for that person.
And Dr. Tony and I are still very interested in talking through a specific show about issues between Aspies and NTs in marriage. So if you have specific questions about these relationships, please go ahead and post them for the Ask Dr. Tony series on Autism Hangout, and eventually we'll have enough that we can dedicate a show to it.
Okay.
All right, the next question says, Dr. Tony, I have a close Aspie relative who has intentionally bullied me over the last year. In the past, he just acts like nothing has happened when he ultimately cools down. But he has withheld information, he has made false accusations about me, and he has sent me aggressive email. I have 3 questions about him. How does Asperger's and personality intermix? Surely there seem to be Aspies that are nicer people than others. Number 2, is Asperger's a valid excuse for hurting others without consequence? And number 3 is, what else can I do for him and for me apart from ignoring his rants? This is from Edgley.
Oh, Craig, we've got some very good questions again here. How does Asperger's and personality intermix? Very much so. The question is, how do you react to being different? And what is your underlying personality? Some people will, for example, hate the concept of Asperger's, deny it, etc. Others will say, well, that's me, I'm going to be positive about it. You get the optimists, you get the pessimists. You get those who are by nature calm and accommodating and for whom anger and such behaviour would never be in their thoughts at all. So you can't say Asperger's in general. When you know one person with Asperger's, you know one person with Asperger's. Mm-hmm. So the personality does intermix, but also what intermixes with that is experiences, peer group comments, that makes each person with Asperger's unique. But when I do an assessment, one of the things I'm looking at is not just what are the Asperger characteristics, but who's underneath the Asperger's? Who's the person? Who would they have been if they didn't have Asperger's syndrome? Mm-hmm. And some personalities are endearing. Teachers know that, and it brings out that maternal kind instinct in other people. And then, unfortunately, there are those who, for various reasons, are abrasive and annoying to others. And it just seems to be a personality component. Mm-hmm. Now, the second part is Asperger's a valid excuse for hurting others without any consequences? It is certainly not. And those with Asperger's are usually wanting social justice and equality. Mm-hmm. And so it is very important that Asperger's will describe difficulties, but not make you immune from consequences. And that's not only within a family, that's in law. Someone with Asperger's is not mentally disturbed and not responsible for their actions. They are very responsible for their actions and must have consequences. Now, this is important at school. So whatever is the school consequences, that must occur. But it must be equal justice when all information is disclosed. Otherwise, the amount of damage is indicative of the amount of guilt, and that may not be the case at all. Mm-hmm. Now, what else can I do for him apart from ignoring his rants? With this situation, if I was working with them, I would want to know why there is that antagonism. Sometimes it can be an injustice that's occurred, an event that the person has said, well, you broke the rules with this, and it's now a sort of a, I now perceive you in a different light, you've broken the rules, and now they've got a mental set of only seeing in that other person things they do wrong. Mm-hmm. They're not doing a balanced perception. They only spot the mistakes. And so it's really getting them to re-perceive the person, not as somebody who you must use all these bullying tactics to work with. Mm-hmm. And what I would do is then go through that person and say, look, you're under control. You are trying to control your life to avoid unpleasant situations and make your life easier. But the way you're doing it is bullying, punishment, aversive. It's a very powerful way of manipulating people. To say, look, you can get what you want by being nice. Yes, you can. And if you are complimentary, you are supportive, and you are kind, you will probably get more. So if you want to manipulate people, if you want to control your environment, yes, you can, but you don't have to do it by being mean and nasty. Mm-hmm. You can, and that's where the person has to actually learn the nice way first. Mm-hmm. And I say to the recipient of that, look, when he's nice, give him twice what he wants.
That's
so
right.
that it works.
So it sounds like, Edgley, you do have something that you can do to help affect his behavior. That's great.
Yes. Yeah.